717 is a tool that can be used to improve disease outbreak timeliness, and the numbers 717 just stand for 7 days to detect an outbreak, 1 day to notify the appropriate public health authorities of that outbreak, and then another 7 days to complete your early response actions. Burnett is currently the technical lead for implementation of 717 in the Pacific, and we're currently working alongside our partners, particularly SPC or the Pacific Community at their One Health department, on implementing 717 not just in Vanuatu but across the Pacific. So we had a workshop with SPC and the Fiji Ministry of Health representatives, and we're looking forward to working alongside the Pacific community further and doing more implementation in other countries. So it's a very useful tool because it's simple. First of all, it's a very simple template that health authorities can use, and it doesn't need big expensive technologies, for example. And you can train health workers at all levels of the health sector to use it, even down to a village health worker or provincial surveillance officer. And they can use it in the field and not just after the outbreak has ended, but while it's happening, and continuously improve their response while they're responding to the outbreak. So currently we're using it in Vanuatu. We're working very closely with the Ministry of Health. Most recently, we used it in the pertussis outbreak that occurred in Tawhea and Shefa provinces, and the tool was used on the field by the Tawhea Provincial Surveillance Officer as well as the Shefa Provincial Surveillance Officer, and it went really well. They were both able to identify challenges that they were facing in real time as they were responding to the outbreak, but also we were able to see in real time what things that were happening in the hospitals, in the lab, in the provincial health offices that were actually helping the responses to these outbreaks, and we were able to document that in real time. So the e-notification system does feed into 717, and it helps us with both detection and notification. So as the officers in the provincial surveillance office and the labs and the hospitals are reporting using the e-notification system, we're getting these reports right away, and it helps the National Surveillance Unit with seeing or detecting or seeing if the number of reports are going over a threshold depending on the disease, and then they can then get back to the people who are in the field and have them double check these numbers and confirm if it is indeed an outbreak. So that's helped with improving our detection timelines. I think that the 717 is a special tool, because I think there's so much opportunity there for it to be molded in a way to fit the ways of working of the people who are using it. So it doesn't just have to be used for human health, but for example, in a One Health context, for environmental health, animal health,